For decades, the NHS has been the backbone of British healthcare, a system built on the promise of care for all. But today, that very foundation is crumbling. The UK is witnessing a mass exodus of doctors, with a shocking 15,000 to 23,000 NHS doctors leaving their jobs between September 2022 and September 2023. The loss is not just about numbers, it's about lives, about a system stretched to its limits, and about a government that seems unwilling to listen. The financial burden alone is staggering. The cost of replacing these doctors is estimated at £1.6 billion to £2.4 billion per year. And if urgent action isn't taken, this could skyrocket to £5 billion annually. But why are doctors, who once saw the NHS as their calling, now walking away in record numbers? A General Medical Council report reveals that 79% of doctors are leaving due to low pay, forced to work exhausting hours for wages that don't match their responsibilities. NHS salaries have fallen so far behind that junior doctors now earn less than some retail workers. Even those who love the NHS and its mission can't ignore the financial realities. The situation is so dire that many are leaving for Australia, Canada and New Zealand, where they can earn up to 3 times more while working fewer hours without sacrificing their passion for medicine. But money isn't the only reason. 75% of doctors say they feel undervalued, not by their patients, but by a system that treats them as disposable. Overcrowded hospitals, endless paperwork, and a lack of career progression make many feel like they're stuck in a never-ending cycle of exhaustion. For 72% of doctors, it's about more than just wages, it's about mental health and work-life balance. The NHS is no longer just a workplace. For many, it has become a source of burnout, stress, and despair. And the consequences? Patients are suffering. Fewer doctors mean longer waiting times, overburdened hospitals, and increased pressure on the remaining NHS staff. The British Medical Association warns that unless things change, the United Kingdom will continue to train doctors, only for them to take their expertise abroad. Writing off student debt, reversing real terms pay cuts, and improving hospital conditions are obvious solutions, yet action remains painfully slow. If this trend continues, the United Kingdom won't just be losing doctors, it will be losing the NHS itself. So the question remains, can Britain save its most cherished institution before it's too late? Or are we witnessing the slow collapse of the NHS as we know it?